Telehealth has been a great tool. It's, the ease, the convenience, conversing back and forth with the doctor concerning medication has been really helpful as far as the time it takes and the ease that it is. And it's a pretty powerful tool.
The role the Center for Telehealth plays in education, certification, impact, evidence generation is as a connective hub across these critical domains. Our education and certification help clinicians develop the competencies they need and the skills necessary to effectively deliver an impactful telehealth experience and encounter for the patient.
By using telehealth, we can increase access markedly. And that access is a key because when we're able to see a patient, speak with a patient, that really is the key to healthcare.
We utilized the resource that American Heart had provided for us, which was the telehealth certification. And it's been a wonderful piece because we're more comfortable, we're confident when we make those phone calls. If we would make a phone call and the patient didn't answer, what kind of information could we leave on the phone as a voicemail through telehealth? What's legal? What's breaking HIPAA? The telehealth certification addressed all of that.
The American Heart Association has been using a model to utilize our different hospitals, clinics, and health systems by placing them in very specific cohorts based on the impact and the learnings and insights that we try to gain. When you have the ability, like the American Heart Association does, of bringing together a geographically diverse type of group of clinics to talk about their challenges and their solutions and their capabilities and their resources available for telehealth, you gain the insights of how their technology is working. And these insights help inform the Center for Telehealth and how the Center for Telehealth can be supportive.
So our partnership with the American Heart Association and Telehealth Learning Collaborative has really, for us, made it possible to highlight our community model in making sure that our patients are connected to their providers. And it really has brought visibility and validation for all the work that we're doing.
We really focused on understanding what are the nuts and bolts that need to be in place when you're thinking about coming up with a solution. So I think one of the great things in getting started is understanding and learning from our other sites, having those logistics, understanding from the team, following the American Heart Association's leadership in this space has made it an essential part of our experience and success was using telehealth at Johns Hopkins.
So this project has been extremely helpful in bolstering the accuracy of our data, which then gets reported back to a lot of these clinical quality metric programs. This is extremely important for the health system at large because we are reimbursed based on our merit.
Understanding these types of situations and case scenarios help the Center for Telehealth gain real-time insights to be able to take those models that have been successful, those barriers that have been solved, and share them with others across the country.
For health systems that are trying to implement RPM, my advice would be, number one, pay very good attention to buy-in, but not only from providers, buy-in from the patients as well should be the focus, because in the end, that is, you are driving care and improving care for the patients.
First, take a look at the services you offer, look where there might be gaps that you can backfill with this technology. Also invest in the training of your people on the technology and the tools, and of course, your IT infrastructure, et cetera. There are a lot of external sort of stakeholder departments that you want to involve in this to make sure that you're bringing the best product to deliver the right care at the right moment for that patient.
Having a presence outside the walls of our clinic is equally important to what happens inside the clinic. And it's not only what happens in our kiosks, but on our outreach, at our food pantries, our nurse visits when they go and visit a homebound patient. Those types of services is what helps the health center stand out from others.
And so this group has been a pilot It's a pilot that has been able to give the Center for Telehealth these real-time insights that gives us the opportunity to grow our education as well as understand what needs continue to be out there for clinics that work in chronic care. The Center for Telehealth can help understand utilizing these types of real-world implementation science type models to develop based on what we're hearing from real life experience within these clinics.
What we found with telehealth care using our patient portal as well as telehealth visits is it does enable us to accelerate that patient getting on the best therapy and getting to their LDL goal. And we're talking about life-saving therapies. And the earlier we get to goal, the better.
With our RPM program for hypertension, we found that patients that were enrolled in the remote patient monitoring program saw significant reductions in both systolic and diastolic blood pressure compared to those patients that were receiving usual in-clinic care only.
We found that by year end of the program, 24% of participants achieved controlled blood pressure. That was an indicator that this program is effective.
We need to be leaders in building a digital ecosystem, including telehealth, including smartphone apps and wearables and AI that is able to reliably help us do our job to serve patients.
What's next for telehealth here at Waianae is definitely advancing our use of AI technologies in the care that we provide to our patients. We're starting to use AI in case management, care management, to be able to understand our population a little better, to understand what types of interventions would be best for our patients, and not only for our patients, but also a return on investment for the health center as well as for our health plans.
Telehealth is going to be moving. It moves quickly, things change, policies change, but we can stay at the center and work as we have as a facilitator and a moderator and a convener to make sure that we are staying in the center of all the changes and the future as telehealth evolves.